Well, it's no coincidence that we're here on the 1st of April, because the 1st of April marks a year since the introduction of the Care Act. And those of you who follow these things will know that the Care Act potentially heralds significant changes for carers. And if it's okay with you, I'll ask you, each of you, to just quickly introduce yourselves. Perhaps say your name and which organisation you're from.
I'm Chloe Wright. I'm Policy Manager at Carers UK, which is a national membership organisation of carers.
Hello, I'm Sonia Watts. I'm Head of Carer Services at Action for Family Carers.
I'm Rachel White, with the Experience of Care team at NHS England.
I'm Kirsty O'Callaghan. I work as a Commissioner at West Essex Clinical Commissioning Group.
Hello everyone, I'm Nick Thurlow-Brown. I'm the Carer Support Manager for North Essex Partnership Trust.
Good morning, I'm Catherine Wilmette and I'm from Essex County Council.
It's my observation that we have been very poor, we statutory agencies, over the years at even knowing who the carers are in lots of cases. The Care Act is a prompt, but there are other prompts. We are strapped for resources. We continue to be. There is a massive resource out there in carers, and it only makes sense for us to be working together with carers. In my own organisation, we're currently engaged on identifying our carers, talking more to our carers, finding ways that we can actually work together. But we are at the beginning of something that's going to take quite a long time, I imagine.
Just to add to that, I think that's right. I think we haven't, certainly from adult social care, we haven't always been very proactive in working with carers to think about what happens if something happens to you. And I think that is a really important part of what we need to start doing. We're trying very hard to work in a different way with carers. We're at the beginning of that journey, and what we hear today will help inform some of that. But certainly working with people to try and understand what support do you need to enable you to carry on caring, and what support would you need if something happened that meant that you couldn't continue caring, either permanently or temporarily, is a core part of what we want to do going forward. So I think in the past it's been probably hit and miss isn't quite the right word, but I think probably some people may have had a good experience of that, others will have had a poor experience of that, and we're trying to make it much better so that everybody has a good experience of it.
And through the Carers Partnership Board and the work that we're doing, we've actually come together as a group across the system, which we've never really done before. And that has all been about going out, engaging and actually understanding what personal goals and personal needs carers in Essex actually have. A big thing for me has been recognising that the person in the bed can be a carer and can also be looking after a person at the same time. And we've invested really heavily as a group in terms of the supporting carers in Essex and the link workers we've got in our hospitals and our community provision. The next big challenge for me is primary care.
There are points not only about how disconnected primary care and health care in the NHS is from social care, but also about how the social security system is separate and there isn't necessarily one place for carers to go to, and they need to spend an awful lot of time kind of piecing their different rights together. So I think as well as integrating our social care and health services more, we also need to look at where their services can have a better idea of carer support in the round, including from the social security system.
You know, our role is to try and bring everything together, to try and solve some of those problems where you're trying to navigate systems yourself. Having that one point of contact, that single point of access where you can access all of the support that you need across Essex to simplify all the services has been key. And we're a year into the contract. It's been going extremely well. We've worked with a large number of carers, but obviously we know that there's still a long way to go.
NHS England is supporting that to happen. Work is currently going on at the moment to harness the voices of carers and to make sure that that's influencing a lot of the national planning that's going on. And I think one of the key things that NHS England can do is make sure that those opinions, views, evidence is influencing policy.
It is standard. It's a standard key performance indicator in our mental health contract that is offered. And we do monitor that quite closely. The area that is not quite so well developed as we would like it to be is with our work with the police. However, we've come together through the Crisis Care Concordat in Essex. With all these things, it's culture change. It does take time, but the intent is there, and it absolutely should be the offer as standard.
Can I just make a point on that culture change? And one of the things that we're actively saying in this and all other areas is look for the carer. And when you've looked for the carer, look for the carer again.
Which is why we need statutory services to be very active in helping carers to identify the role they're playing and the impact it might have on them. The Care Act does place a duty that carers should be identified and that they should be offered a carers assessment, so it should be a kind of proactive step.
A recent Healthwatch report identified that a significant number of people who had a carers assessment didn't really notice any difference afterwards, and quite a significant number of people didn't know whether they'd had a carers assessment. And I think that says an awful lot. But actually having a conversation with a carer or carers, sometimes there's more than one, around how is your life, what would improve your well-being, how can we support you, I think we're probably going to reach better outcomes by working in that way than trying to sit down and formally say, right, you're having an assessment now, and you must know that you're having an assessment, and there will be something different at the end. Certainly I was very struck by that piece of Healthwatch research around the number of people that didn't know they'd had a carers assessment, and clearly they'd been through some process or other, but it wasn't recognisable, and it didn't really make a difference. So we have to do something different.
Supporting Carers in Essex works with carers aged 8 years and up, and a lot of the work that we do is within schools and educating the school staff, so be it the head teachers, the teaching staff, and also the school nurses, to help them identify young people who are in that caring role. And it is about reassuring them that you're right, there's a safe place, you can talk to people. It doesn't mean that you're going to be separated from your family. It's about supporting the family so that they can remain in that family unit and continue to support each other.
Culture change takes a long time. Although people want to do the best job they possibly can and want to help people, that's why they're there. Sometimes in the past we've set up systems that get in the way of that. We've tried to dismantle those systems, but it takes a bit of time for people's behaviour to change in line with that. So I don't underestimate how frustrating that is, and it's certainly an experience I've had in different arenas of life where you get passed from one to the other, and I know how frustrating that is. We are, from social care, working much, much more closely with colleagues in the NHS than we ever have done before. And we are fairly broadly now working as part of community multidisciplinary teams, which are chaired by the GP. So the GP is quite central to those meetings. But there are people there from community nursing, there are people there from social care, there will be other community services there as well, and they will be able to help each other to identify, actually, we can offer this support to this individual.
I think it's crucial that carers give us support, because they do, but we need to do that in a coordinated way. Hearing what the carer does, hearing how that helps with what other people are doing, professionals particularly, is the only way that you're going to give a rounded service to people.
But what we have invested in is a social prescribing model that basically means we have members of staff, volunteers working in GP practices who are able to spend a considerable amount of time with carers, with patients, to connect them up more appropriately with services.
I think it sounds like there's some really good practice developing in Essex, actually. But I think there's kind of two issues. One is where kind of carers are forced to be the glue between services because they don't talk to each other, and that can be very frustrating. And the second one, I think, is more about kind of the involvement of carers and recognising their expertise.
Yeah, there's some huge amounts of national work going on at the moment. We are working in collaboration with people like Carers UK. One of them is a sort of a memorandum of understanding, which is a sort of an agreement document. Part of what you could introduce into that memorandum of understanding is a local agreement around data sharing, or information sharing for the purposes of service improvement.
You know, we all know it's a massive problem. It's probably going to get worse. And it's something that we all know that we need to tackle, but I'm not sure exactly what the answer is, you know, today, unfortunately.
They're just, there's a sort of anemic market and choice in care services, which is what work is obviously underway in Essex to kind of work on that. And that's something the Care Act touched on and placed a duty on, kind of boosting the choice of services. The other one I think is for people that have local authority funded care packages and ensuring that those keep pace with the increasing cost of a personal assistant's wages. In very kind of financially difficult times for local authorities, they need to try and be responsive and be increasing the care packages to keep pace with these extra costs. Otherwise, families are the ones who are trying to find the extra money, which they don't have.
There's much greater recognition now than there used to be around the needs of people on the autistic spectrum. And in terms of young people who are becoming adults, going through transition is generally the term that's used, adult social care work very, very closely with children's social care who will have been providing support to the child and their family. And we try and work very closely with them from the age of around 14 to plan on an individual basis how that person will be supported through adolescence and into adulthood.
It's about ensuring people know their rights. And within the Care Act and Child and Families Act, as Catherine was saying, you do have the rights, the young person has the rights before they go into the adult services to have a child needs assessment. And it's about working and looking at the transition and what's going to be needed for them as an adult. And so you're not working in that crisis point, you're actually looking in a preventative way and looking at what is going to benefit that person as they get older.
We do look at all the complaints, we do respond to all the complaints, and we do learn from the complaints. And certainly the complaints that I see, there's always an action plan that comes out of them, so that whether it's about one individual worker or whether it's more of a system that isn't working right, then we go back and we look at what we need to do differently so that somebody else doesn't have the same experience.
I think we have incidents sitting here. I think we have, you said we did aspects sitting here. We have, compliments sitting over here. So they're all sitting in grand isolation. I think one of the key challenges that every area has got is finding a mechanism to pull all those voices together in one place. And for that to drive improvements. How are we going to pull them together in one place, and how are we going to demonstrate that we're listening, using that as an evidence base alongside other harder evidence base to drive the planning process locally? I see Healthwatch as being absolutely pivotal in that sort of an arrangement. That's about sort of trying to encourage GPs to pay a bit more attention to carers, and it's going to be part of this accreditation scheme.
And whilst it is early days, you've just mentioned an accreditation scheme. We've started to design an accreditation scheme that focuses on getting the receptionist, getting the practice manager, as well as the GPs, to identify carers when they come in, starting to think about the language we use, because you're not necessarily going to say, this is my husband, wife, son, daughter. You don't recognise you're even a carer. So that's a piece of work that we've started to design and we're doing.
And then we'll be working with the GP surgery staff to try, and again, it's that culture change, try and get them asking the right questions. It's not about asking somebody, are you a carer? It's about seeing somebody come in with their loved one and recognising that, and then having the right conversations to try and identify them and then put them in touch with the right support services.
We absolutely need to harness those voices and use that to make differences locally. It's the only way that we are going to make changes. But unless we really understand what is working for people and what isn't working for people, and use that as real evidence to drive changes in the system, that's the only way that you'll end up feeling those differences and feeling those improvements.
If there are specific needs that a carer has because of caring for a deaf-blind person, then we would want to approach that in the way that I described earlier, a much more fluid conversation around what will work for you and what will help you to continue caring.
Where a carer's assessment is needed, that information's properly knitted up. So if they're being carried out by two different organisations, because the local authority's delegated it to two different places, is it making sure it's bringing that information together so that the assessments are properly linked up and referenced to each other properly?
We have an end-of-life service that works with carers of people who are approaching the end of their life, and also for 12 months post that period as well. And I think their experiences, they're very reflective of all carers, but equally you're then dealing with the knowledge that you're going to lose your loved one as well. So it's extremely difficult. So the frustration was of getting everybody coordinated so that that care is in place for you at that time. It is really difficult. I mean, we have the carer support workers that we have within the end-of-life team. That's a big part of their role, is trying to coordinate that, to take that burden away from you.
Certainly the work that Healthwatch do does have an impact. I'm sure Healthwatch know that, but just to reassure people that that the reports and the information that they produce, we do all read them. We do all act on them as far as we're able to. So it's not going into a void and completely lost. It is very active information. Healthwatch are part of the Carers Partnership Board, a big part of that, and involved in all sorts of other initiatives, both with Essex County Council and with all the other organisations represented here. So whilst Healthwatch isn't the only organisation by any means, it's just to give that reassurance that what Healthwatch produce we do look at and we do take on board.
And I think it's important to say that, for instance, with the 555 report, that affected some real change in terms of our commissioning decisions around mental health provision specifically.
It's been a fascinating and insightful discussion. So really all I have to do is to thank you all. My plea to you all is, let's think, as we come away from this morning's meeting, let's think about what are the realistic and practical next steps that we can all do to start changing things for the better. But I would just reiterate my enormous thanks to the panel. I think you've all done brilliantly and you've spoken honestly. But also thank you to all for coming too.